After suffering an injury to your knee, is feeling that your knee wants to give out, is that a bad sign? And what types of knee injuries would actually cause that feeling? I'll discuss the possibilities in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and I'm an anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, this video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Here's the question. I hurt my knee. I watched your video on how to know if your knee injury is serious. I have all three of those worrisome symptoms, basically not being able to straighten my knee all the way, significant pain when I try to straighten my knee, feeling like my knee isn't stable and it's going to give out, and when slightly turning, it feels like the knee isn't secure. So what could it be? All right, I do want to say the answer to that I'm about to give in this video, like all of my videos, I'm not giving medical advice. This is meant for general information and educational purposes only. And yes, feeling like your knee is going to give out is a sign of a serious knee injury, especially after you land from a jump and your knee gives out, or you're running, you plant your foot, twist, you feel a loud pop, and then your knee's unstable. Now, not all instability or feeling like it's unstable is bad. If some of that is what we call quad weakness and a subjective instability. It's like if you go hiking for the first time in a year, you hike for 4 or 5 hours, and then it feels like your knee's giving way. You didn't all of a sudden tear your ACL or something like that. That's just your quads being weak or fatigued, and then it feels like your knee's giving out. That's not what we're talking about here. What we're talking about here is your tibia shifting out from under your femur, or it feels like it's going to, and then your muscles sort of catch to prevent that from happening. By far the most common injury you're talking about there is a torn ACL, especially after a traumatic event. Again, you land awkwardly from a jump, you feel a pop, your knee gives way. You're running, you plant your foot to change directions, you feel a loud pop in your knee, you fall to the ground. Those would be signs of a non-contact ACL injury. Could potentially be some other kind of internal ligamentous injury, PCL maybe, multi-ligament knee injury, but typically what you're thinking about is ACL. Could it be something like a patellar tendon or quadriceps tendon? Yes, but typically you can't even get back on your feet and use it, so that's much less likely. What we're talking about here is somebody that is back on their feet trying to figure out what it is. And if it truly feels like, with my knee model here, like the tibia is shifting out from under the femur, that is a sign of most likely an ACL tear, but some kind of ligamentous instability. So I hope that's helpful. Now, I've written an ebook, not about ACL injuries, but it's one you might find helpful. It's called the Arthritis Solution. You can get it free by clicking the link in the description below. Now, if you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, there's another link you can click. It's in the description under this video. Go to that. It takes you to the contact page on my website. There's a form there. Fill that out, and you can work to schedule an appointment to see me specifically. Now, I'd love to hear your experience with your knee injury, whatever it is. Fill those out, leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice, but what I sometimes do is I answer that question in a future video like I did here. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.